Hi, everyone, and welcome back to the Vet Scholar, your go-to resource for veterinary education. If you're new here, don't forget to hit the like button and subscribe to stay updated on our latest videos. Today, we're continuing our series on veterinary endocrine diseases, and we'll be diving deep into a complex yet crucial topic, hyperadrenocorticism, more commonly known as Cushing's disease. This will be a longer video as the disease itself is multifaceted, so be sure to stick around till the end, where I'll provide a list of important factoids to remember. As always, we'll be breaking this topic down into the following sections. 1. Introduction. 2. Pathogenesis. 3. Prevalence and signalment. 4. History and physical examination. 5. Diagnostic test findings. 6. Treatment options. Let's get started. Hyperadrenocorticism, or Cushing's disease, is primarily the result of excess cortisol production, which can occur naturally or due to long-term steroid administration. In veterinary medicine, it was first identified in dogs in 1939 by Veterinary and Thunen. However, the condition was first described in humans by Dr. Harvey Cushing in 1912, making him one of the most iconic figures in the field of endocrinology. In dogs, this disease primarily involves two forms: pituitary-dependent hypercortisolism, PDH, the most common form; adrenal-dependent hypercortisolism, ADH, which is less common. Now let's break down exactly what's happening inside the body with these forms. Of the two, pituitary-dependent hyperadrenocorticism, PDH, is more common. This accounts for 80–85% of cases. It results from a functional ACTH-secreting tumor in the pituitary gland, leading to bilateral adrenal hyperplasia and overproduction of cortisol. These tumors can occur in either the anterior lobe or pars intermedia of the pituitary gland. Most of these are benign adenomas, but invasive adenomas or carcinomas can also occur. Adrenal-dependent hyperadrenocorticism, ADH, on the other hand, is less common and occurs in 15–20% of dogs with Cushing's disease. It results from a cortisol-secreting tumor in one or both adrenal glands. Mutations in the G-protein alpha subunit gene, GNAS, have been identified in some cases, causing unchecked activation of cortisol production pathways. This mutation appears in about 1/3 of adrenal tumors. In both forms, the result is an overproduction of cortisol, which affects numerous systems in the body, leading to the classic signs of the disease. Cushing's disease is relatively common, but its exact prevalence is difficult to pinpoint. The incidence is approximately 1 to 2 cases per 1,000 dogs per year, with a prevalence of about 0.2% for PDH based on various studies. It predominantly affects middle-aged to older dogs, with most cases being diagnosed in dogs aged 6 months to 20 years, but the average age at diagnosis is 11 years. Certain breeds are more predisposed to Cushing's. Take a look at the following breeds. Both male and female dogs are affected, though some studies suggest a slight predisposition in females. In addition to this, neutered dogs of both sexes are also at an increased risk, possibly due to longer lifespans or hormonal influences on the adrenal glands. Now let's talk about the clinical signs that might raise your suspicion for Cushing's disease in a patient. These signs typically develop gradually and can be subtle, especially in early stages. Some of the most common signs include polyuria, increased urination, and polydipsia, increased thirst; polyphagia, increased appetite; muscle wasting and a pot-bellied appearance; alopecia, hyperpigmentation and thin skin; hepatomegaly, enlarged liver; panting and hypertension. Dogs with advanced pituitary tumors may show neurological signs, such as dull mentation, circling, and behavioral changes. Because of the slow onset, owners often attribute these signs to aging. It's important to recognize the combination of these signs to pursue appropriate diagnostics. Let's move on to diagnosing the disease. A combination of laboratory tests and imaging is necessary. Complete blood count, CBC. Many dogs with Cushing's will show a stress leukogram characterized by eosinopenia, thrombocytosis, lymphopenia, neutrophilia, and monocytosis. These are classic findings due to cortisol's effects on immune cells. Serum biochemistry, the most common abnormalities are O increased ALP, 76 to 100%, and ALT, 80, 95% due to liver dysfunction. O hypercholesterolemia, 73, 90%. O mild increases in blood glucose, 20, 57%. Urinalysis. Most dogs will have a urine-specific gravity of less than 1.020, and proteinuria is common. UTIs are also frequent due to immunosuppression and dilute urine. Low-dose dexamethasone suppression test, LDDST. This test helps confirm Cushing's by measuring the dog's resistance to cortisol suppression. The sensitivity ranges from 85–100%, but the specificity is lower, between 44–73%. ACTH stimulation test. This test measures adrenal reserve and has a sensitivity of 80–83% for PDH and 57–60% for ADH. Ultrasonography. Abdominal ultrasounds are useful for evaluating the size and symmetry of the adrenal glands, particularly in ADH cases, to detect tumors. The treatment approach for Cushing's disease depends on whether the disease is pituitary-dependent or adrenal-dependent, but most dogs are commonly managed with medical therapy rather than surgery. Pituitary-dependent hyperadrenocorticism, PDH. The primary treatment option is trilostane. Trilostane works by inhibiting the enzyme 3-beta-hydroxysteroid dehydrogenase, which is involved in cortisol synthesis. This medication helps to reduce cortisol production, controlling the clinical signs of the disease. Trilostane is typically administered once or twice daily, and regular monitoring of cortisol levels is necessary to adjust the dosage and prevent complications like adrenal insufficiency. While hypophysectomy, surgical removal of the pituitary gland, can be performed in cases of PDH, it is rarely chosen by owners. This surgery is highly specialized and is only performed at select veterinary centers. It requires significant aftercare and carries risks such as transient or permanent diabetes insipidus. Additionally, dogs may need lifelong hormone supplementation post-surgery. Due to these factors, the majority of veterinarians and pet owners prefer to manage the condition medically with trilostane. In some cases where a large pituitary tumor causes neurological signs, radiation therapy may be an option to shrink the tumor and relieve symptoms, though it does not cure the underlying disease. Radiation is typically reserved for severe cases where the tumor is invading surrounding brain structures. Adrenal-dependent hyperadrenocorticism, ADH. In cases of ADH, where a tumor in one of the adrenal glands is responsible for the overproduction of cortisol, the adrenalectomy, surgical removal of the affected adrenal gland, is the treatment of choice. If the tumor is benign and confined to the adrenal gland, surgery can be curative. However, adrenal tumors are sometimes invasive or malignant, and removing them surgically can be more complicated, particularly if the tumor has spread. For dogs that are not candidates for surgery, trilostane can still be used to manage the disease by controlling cortisol production. However, it's important to note that medical management in cases of adrenal tumors does not address the underlying mass, so regular follow-up with abdominal ultrasounds is essential to monitor the tumor's progression. Both PDH and ADH treatments require close monitoring of cortisol levels through ACTH stimulation tests or pre- and post-pill cortisol tests to ensure effective control of the disease without suppressing cortisol production too much. Owners should be aware that, while trilostane can significantly improve a dog's quality of life, it is not curative and lifelong treatment is required. Dogs on trilostane should also be monitored for potential side effects such as vomiting, diarrhea, and signs of adrenal insufficiency. In conclusion, the mainstay of treatment for most dogs with Cushing's disease is trilostane, which offers effective management of the condition in the majority of cases. Surgery, while an option in specific cases, is often not pursued due to its risks and the expertise required. That's a comprehensive look at Cushing's disease in dogs. While it's a complex and often challenging disease to manage, understanding the pathogenesis, clinical signs, and appropriate diagnostics is key to ensuring a better quality of life for our patients. If you found this video helpful, please remember to hit that like button and subscribe to the Vet Scholar for more in-depth veterinary content. Thanks for watching, and see you in the next video.